Good morning, everyone. Welcome to Munson Healthcare's COVID-19 press conference. My name is Diane Mihalik, and I am the Chief Marketing and Communications Officer with Munson Healthcare, and I'll be your host today. Today is Tuesday, February 15th, 2022. Also joining me today as speakers will be Dr. Christine Nefce, the Chief Medical Officer for Munson Healthcare. We'll also be welcoming back Dr. Christopher Ledke, an infectious disease physician with Munson Healthcare. And then I'm excited to introduce you to Tony Leaf-Odette, who will be joining us as a Munson Healthcare perinatal grant coordinator and also a member of the community health team and a community health expert. And Tony's going to be announcing an exciting new initiative based on COVID-19 that Munson Healthcare is announcing today. So without further ado, we will get started. I'd like to welcome Dr. Christine Nefce, Chief Medical Officer for Munson Healthcare, to walk us through our current status of COVID-19 numbers. Welcome, Dr. Nefce.
Thank you, Diane. All right, so we do have some good news from our percent positivity. We are down at a state level to 15.5%. So we had not been below 20% for the state since December. So this is really good news as we continue to see that number trend down. If you'll go to the next slide, we are lagging slightly behind downstate, and we are still just above the 20% at 20.3%. But again, we are seeing a nice steady trend line down on our percent positivity as well as our cases per 100,000. So good news there as well. Next slide. Here you can see our inpatient COVID cases. We are, again, holding steady there, not really seeing a decline yet, but we do tend to see the inpatient numbers lag behind our percent positivity as it goes up and down. So that is not unexpected. And if you'll go to the next slide, those are our numbers as of today. And as I said, we are fluctuating. So as an example, we were at 82 hospitalized COVID patients yesterday. We're at 68 today. And we've really been hovering about there for several weeks. I would say, if you average that out to in the 70s, that's kind of where we've been hanging out. But again, improvement in numbers, and you can still see the benefits of being vaccinated and especially boosted in this graphic. Next slide. This is just another representation that shows you there the vaccination status and how that correlates with COVID-19 deaths. So you can see the blue line there is fully vaccinated, that black line is unvaccinated. So a lot of protection, not only from testing positive for COVID-19, but certainly from being sick enough that you get into a hospital and then sick enough to die from COVID-19. Next slide. We have been getting some questions on the vaccine authorization for children under 5. There was a meeting scheduled for today, actually, that has been postponed. So we will continue to follow that. And as soon as we get any information about the advisory panel's new date for voting on this and any recommendations they make, we will let you know. And then lastly, you'll see here our flu cases. So again, we've been lucky enough to have relatively low levels so far, but we are still in flu season. And we will continue to monitor that. Again, at this point, just a handful of cases, although there have been some outbreaks across the country. So certainly it's out there and something that we will continue to keep our eye on.
Thanks, Dr. Nefce. We will ask you to rejoin us once the other panelists have spoken, and we will have one Q&A session at the end of today's sessions. So thanks, Dr. Nefce. Next, I'd like to welcome back Dr. Christopher Ledke, an infectious disease expert with Munson Healthcare. Welcome back, Dr. Ledke.
Thanks, Diane. So there's a specific topic that I wanted to address today, and it is something that I get asked about a lot. And so I thought it would be useful to kind of go through what we know and what we don't know. And that is how this is going to shift to what we call endemicity or an endemic state. Okay. So first of all, this is very hard to predict with certainty, and COVID in general has been quite unpredictable throughout the pandemic. The good news is that it will eventually end. And by that, I mean that the pandemic or the crisis mode that we have been dealing with for the last 2 years will eventually end. And it's probably not going to be full eradication of COVID-19, but instead a transition from what we call pandemic to an endemic state. So the term endemic has come up a lot and is actually a kind of a difficult notion to define, which makes it a less than ideal target for us. So also using the term endemic does impose a bit of a false sense of certainty in a really uncertain situation. So endemicity essentially implies that the virus will continue to circulate long term, but at levels that are more manageable rather than these huge spikes that we've been experiencing. In the endemic state, the rate of infections in the population will be more or less stable over a prolonged period of time, which would typically be years. So apart from new cases, an endemic state would also imply that the healthcare system is no longer being overburdened by hospitalizations and shortages of critical staff. Basically, we would be accepting the level of impact that the virus would have and would no longer be in this crisis mode. So I do expect that over the next few months, cases will continue to decrease to a point where we will have very low levels of community transmission. We are heading there, but we're clearly not there yet. We're still having about 150,000 new cases and about 2,500 deaths daily nationwide, with about 4,000 cases and at about 60 deaths statewide in Michigan still. So at the end of the surge, however, we will have better community protection than at any point in the pandemic, which is a combination at this point of vaccination and natural immunity from infection, as well as something called hybrid protection, which is those who've been vaccinated and did still get the infection, which actually provides a more robust protection than either one alone. So, you know, better times are clearly on the way. The question is how long they will last. So it is possible and probable actually that additional variants will continue to come and go. And I think if we are to live with this virus in a manner that allows us to function as a society, we really need to focus on preventing severe illness and death, which would be through vaccination, and to protect those who are most vulnerable, meaning those who may not mount an appropriate vaccine response or who would have severe complications despite vaccination. And that would be mainly through therapeutics. So recently approved treatment options include oral agents and monoclonal antibodies that appear to be quite effective in clinical trials, preventing the most serious outcomes associated with COVID. These do, however, need to be started shortly after disease onset. So in order to effectively utilize these, we do need better quality, more easily accessible rapid testing. And this should be a priority for the scientific community. So keep an eye out for better testing, cheaper, more accessible. That will be very important going forward. Along with this, we really need vaccinations that provide long-lasting protection and that work against any foreseeable variants. So I want you to watch out for what we call universal COVID vaccines, which would be vaccines that work against multiple different variants or any variant really, or new vaccine modalities like mucosal immunity, which you may have read about. So those are in the pipeline. I don't want to discount the currently available vaccines because they are incredibly effective at preventing severe disease and death, especially when used with boosting. We do know that they significantly decrease the risk of transmission and that those who become infected despite vaccination are transmissible for shorter periods of time. Although clearly as the virus mutates, our ability to prevent all transmission has been hampered, which has been really clear seeing the high frequency of breakthrough cases during the Omicron surge. So I want you to watch out for a few things in the next 3 to 6 months that will that will be critical for determining how this pandemic ends and how we get to the endemic state. One of which is, how long will the protection from Omicron natural infection last, both with and without vaccines? That will be critical. There's a new Omicron subvariant called the BA2, or you may have read it as the stealth variant. And that has the potential to alter the recovery curve that we see that's been noted in other countries who did have an Omicron surge before us. So keep an eye out for that. It'll be crucial to see if new variants emerge, either as an Omicron sublineage or novel variants that further challenge our protection. And if these do occur, how much of an impact will they have? That's really unknown. We want to know what happens to countries with zero COVID policies like China, where their community protection is extremely low due to very low transmission and use of a less effective vaccines. So the issue with this is that this has potential for implications for things like manufacturing and global supply chain for decades to come. So that is a big issue. And then we want to see how will we as a society, mentally and emotionally recover from this shared traumatic time. So we want to watch out for that. So unfortunately, I can't tell you exactly how this is going to end. I get that question a lot. I wish I could give you a guarantee. We may see additional surges. We may not. They may be less impactful, likely to be less impactful, but that's certainly not guaranteed. We may see ongoing low-level transmission. It doesn't mean it will be benign. It doesn't mean that it can't still cause harm. A lot of this depends on the unknowns that I just reviewed. So my advice would be going forward to get vaccinated, get boosted if you are eligible. We do know that the reinfection rate for those who are unvaccinated is incredibly high with Omicron, and that infection with previous variants provide inadequate protection. A study published in New England Journal out of Qatar within the last 2 weeks showed that those who had a previous infection, when they were exposed to prior variants like Alpha or Delta, their protection was quite high, 85 to 90%. However, when patients had a previous infection with COVID and were exposed to Omicron, that protection went down to 55%, okay? So as these variants progress, the protection from natural infection alone has decreased. So clearly you would need an additional level of protection, and that's where vaccination comes in. So I would continue to be cautious in high-risk settings, especially if you are at risk for severe disease or immune suppressed. Know that if you fall into these categories and you do become infected, that there are treatment options that are available and that the treatment options are becoming better quality and more accessible.
Thanks, Dr. Ledke. Thank you very much for that information. It's encouraging to think that we may be moving into a time when we just learn to live with this disease. So thanks for the update. I'm going to ask that you stick around and rejoin us for the Q&A session after Dr. Nefce and Tony have a chance to speak as well. So thanks, Dr. Ledke. Now I'd like to welcome back Dr. Nefce. Dr. Nefce, you just heard Dr. Ledke talk about the possibility of us moving into that endemic state, but can you give us a current status of vaccinations and boosters either in the state or in northern Michigan?
Absolutely, and just to build on Dr. Ledke's comments, vaccination is one way we will be able to move as a community towards an endemic state. So I just wanted to review where we are. So you can see here, we certainly do have many people who have been vaccinated in the state of Michigan, although we have kind of held steady here over the last few months and seen not a lot of movement between those that have completed their vaccine series. So while we do have a good number of people that have been vaccinated and boosted, we still have a decent number that have not. And you can see here, I mean, certainly this makes sense that the more at risk you are by age or other factors, the more likely you are to be vaccinated. Obviously, the children in this group have had access to the vaccine for less time than our older population. But you can see that trend line there. And certainly we have room for many more of our community members to be vaccinated. Slide. And there you can see the completion rate of 62.3. Certainly we are doing well in Northern Michigan, so I probably don't say it enough, but thank you to all our Northern Michigan community members who have gone out and gotten vaccinated. It's very much appreciated, and I think part of the reason why we have done as well as we have here in Northern Michigan in our hospital system. Next slide.
I think that's it, Dr. Nefce. Thank you so much. I think that paints a really good picture of where we are with the vaccination rates right now, which is the perfect segue for me to introduce Tony Leaf Odette, who is a perinatal grant coordinator with Munson Healthcare, but also a community health expert and community and population health expert. And Tony leads a variety of community health initiatives throughout Northern Michigan. And we're excited to have you here today to talk about a new initiative through Munson Healthcare. You just heard Dr. Nefce again talk about vaccinations. So Tony, what is this initiative, and what can people, how can people engage and participate in this?
Hi, sure. So Munson Healthcare is pleased to present the Voices for Vaccination Regional Art Contest. This is an opportunity for us to band together to take action against COVID-19. The Department of Veterans Affairs and the Department of Defense in the past have historically utilized artists as trusted messengers to address public health concerns. And so we thought that we would bring something like that to Northern Michigan. Currently, when we talk about Voices for Vaccination, we are asking for art submissions that could be made available between today and March 15th. We would really like people to promote the consideration of encouraging people who might be immunocompromised to consider getting the vaccine. So we continue to know that it's one of the most important things that we can do to protect ourselves, and art is universal and it's subjective. And so it really allows us to create a better world through self-expression. So we're looking for any medium. You can do something like photography, drawing, painting. We would like the base width to be no larger than 36 inches, if that's possible. And sometime in mid-March, these will go up on our website, and the public will be able to vote on the best pieces that they would like to see move forward. So we have 3 different judging categories. We have children 8 years and up. I'm sorry, children under 8 years and up. We have youth ages 9 to 17, and then we have 18 and up. We will be awarding cash prizes for the top 3 submissions. Again, this is voted on by the community through a digital art show on our website. And then also all youth and child submissions are going to receive a prize for their support and their efforts. And these will be displayed at targeted locations around Northern Michigan. So if you're interested in submitting, or if you know someone who is, we really encourage you to visit our blog. That's at www.munsonhealthcare.org, and it's a / Voices for Vaccination. You can complete an online registration, and you can upload your work digitally there, or you can email it to me at voicesforvaccination@mhc.net. You can also bring your submission and a completed form that's been printed from the website to one of the drop-off sites that we have available, and those are listed on the website. So I really want to thank our community partners. We have over 60 now that have joined with us in this call for submissions, and who will be volunteering to be either a drop site or to display artwork. We also want to send out a special thank you to Lake Effect Digital, who have been working on some wonderful graphic design for us.
Tony, thank you so much for announcing that and for joining us today. We are so excited to have you leading this initiative with all of those community partners. And what a great way for the Northern Michigan community to participate and engage with us on this initiative. So thank you for introducing that. And I encourage everyone with any even if you're not artistic, even if you don't think you are, there's ways that you can express yourself and submit your, whatever medium you prefer, and help us get the word out about how important vaccinations are in keeping our communities protected. So thanks, Tony. I'll invite you to stick around for our Q&A session, which we'll get into next. I'll ask Dr. Nefce and Dr. Ledke to rejoin us. Thank you. All right, we will be answering questions. So if you are a reporter directly logged into the Zoom, you can ask your question through the Q&A feature. And if you are joining us live on Facebook or through one of our media feeds, please submit your question via Facebook and we'll get to as many as we can as time allows. So first question is for Dr. Ledke. And it reads, we've recently seen a new variant overseas people are calling Omicron 2.0. Is there any concern of that variant here in the US and in Northern Michigan?
Yeah, so this has a couple different names. You see it as Omicron 2.0. You might see it as the stealth variant of Omicron. You may see it as BA2, which is the kind of the scientific name for it. This is a sublineage of Omicron. And what I'll give you kind of a little summary of what we know so far. So it is, first of all, not it's not any worse in severity than the original Omicron. It appears to be more infectious, and that is based on data out of both of the UK and Denmark, where they're seeing more secondary cases per household case and per community case when the variant is known to be the stealth Omicron. So by stealth, that actually refers to a research finding. It does not mean that it's any more difficult to pick up with testing, with antigen or PCR testing. So our tests are still picking it up. They have a lot of data coming out of Denmark because they have a substantial sequencing platform there. And what they're seeing is, instead of a sharp curve down after a peak in Omicron, it's likely affecting how rapidly they recover from the surge. So it's probably not going to be hugely impactful, but it may affect how quickly we recover. It has been identified in multiple US states, not yet in Michigan, although our sequencing is a little bit slow. There's a delay in when they're sent out and when we get a result. So it's not clear if that sublineage is actually in Michigan, but we don't have confirmation of that.
Thanks, Dr. Ledke. Next question is for Dr. Nefce. Dr. Ledke mentioned the use of monoclonal antibody therapy and some of the other oral medications. Can you give us a status of the supply available in Northern Michigan right now? Because I know in previous press conferences, we've said that the monoclonal antibody therapy was in very short supply.
Yep, and that continues to be the case, very short supply. We are seeing patients still and providing that, although in much less quantity than we did in the past. And that is for Zitrovimab. So we are still getting some allocated from the state, but less than we would certainly like. The good news is we just did hear this week about a new monoclonal antibody that is effective against Omicron, and that should be available, if not this month, next month. So we haven't heard any details yet from the state, but we are looking forward to potentially receiving that in addition to our existing monoclonal antibody. And we are hopeful that that will allow us to expand how many people can be treated. I do want to reiterate, however, that we do also have the oral antivirals that are available. And so that is just another for people that have risk factors and test positive. Please work with your primary care physician. If you aren't high risk enough to qualify for the monoclonal antibody, the oral antivirals may be an option for you.
Great, thanks, Dr. Nefce. Dr. Ledke, one more question for you. Can you please talk about a fourth vaccine shot? Are you recommending them for some people? And do you think the category of people eligible for fourth shots will be expanding?
Sure. So let me just outline how it goes right now. So if you have a good immune system, if you have a good, healthy immune system, you typically would get 2 initial doses, and then 5 or 6 months later, you get your 3rd dose, okay? If you are immunocompromised, you meet criteria to get that initial series of 3 doses, okay? And then the booster dose, we call it that late dose or booster dose, that would be the 4th dose, okay? That's been protocol for quite some time. What I think you're talking about is a 4th dose after that booster, or in some cases it would be a 5th dose, okay, for immunocompromised patients. So they're looking into that, and actually Israel has been doing that for some time, and they have data that suggests that it does provide additional protection when given as a 4th dose for those who initially get a 3-dose series. So it has yet to be utilized here. And what we are seeing, however, is the more data coming out of how much more protection that booster provides. And unfortunately, our booster uptake nationally has been pretty poor. About 50% of US patients who are eligible for that booster haven't gotten it. So we may come to a point where we recommend an additional booster, but people really need to focus on getting that booster that's already approved and being distributed. So more to come on that, but if you are eligible to get that booster, please know that your initial series, if given months ago, is probably waning in its protection, and you need a booster if you're eligible.
Great. Thank you, Dr. Ledke. Really good information there. Next, I'm going to ask Dr. Nefce to comment on this first, and Dr. Ledke, please feel free to follow up with any comments. But the question is there any chance that the decline in positive cases is related to people testing at home and not reporting them, especially with the recent free testing availability from the federal government?
Yeah, it's a great question, and I think we tried to address this last week too with the health department, and that is that the testing and reporting is certainly not perfect. So while we are likely missing some positives that are home testing and not reporting that, we do think the general trend down is likely accurate. So I would look at these testing numbers as more a reflection of what's going on rather than an actual true numeric number of what's going on. But yes, certainly that is the case, that we are probably missing some that are doing that home testing, but I think the trend is true.
Dr. Ledke, any follow-up comments?
Sure. Yeah. So at-home testing is not all that new. We've been doing at-home testing for quite some time, and definitely underreporting is an issue, as it has been for much of this pandemic. I think that this is a true drop in cases. That's quite clear, because we're seeing that globally. We're seeing that nationally in virtually every state, major drops in cases. That is reflective of basically every susceptible host being infected, or all those who can reasonably get infected are getting infected, and then basically the virus is running out of susceptible hosts, and new cases are decreasing. So definitely underreporting is an issue, but this is a real legitimate drop in cases.
Great. Thank you, Dr. Ledke. Thank you, Dr. Nefce. The next question is for Tony. Tony, could you please reiterate what types of art will be accepted? And is music acceptable?
Hi, sure. Yeah, we would love to see some music. We would love to see writing. If you have music, we would like the recording to be limited to 2 minutes. And if you decide to submit writing, that would be less than 500 words. We really would like people to think outside of the box. If you're knitting something, really get creative and show the kind of art that we can really create in Northern Michigan.
And Tony, how effective do you think this campaign will be with getting the message out? I'm asking that personally just because there's a lot of messaging out there right now, whether that's through advertising or public service announcements. How do you think this might reach a different nerve in people or a different way to reach people?
Yeah, thanks. That's a great question. So really our effort here is not to push people to get vaccinated, but it's to put the message from people that we haven't heard from before out there. So whether you're a child that schedules have been disrupted, or you're someone who maybe you're a grieving family, or maybe you're a healthcare worker. We want to hear from all of those voices, and not just from our organizations and our healthcare teams. So I think that will be beneficial. And then also we will have information for where to go to get vaccinated posted next to these pictures and next to this art. We have 2 different galleries going up, one at Dennis Museum and then one also at the Ensemble Artisan Center for those rural community. And I think if people in their regular everyday settings can see this artwork without searching it out, that it can be really beneficial for our movement. And it's just a bit different. It's trying something new.
I love it, Tony. Thank you again. Really excited to see the submissions that you receive. Getting back to some of the COVID-19 questions, Dr. Nefce, I'll ask you to comment first, and then Dr. Ledke, please feel free to follow on. I'm going to combine 2 questions here because they're very similar, but basically we have been hearing about school systems lifting their mask mandates. So the questions are really, do we think that the mandates have been lifted too soon, or is it okay to relax a little bit more now? Dr. Nefce?
I mean, it's a good question, and in some of that time will tell. What I can say is that our health departments and our public schools have been great partners with us throughout this. There's been a lot of conversation and support of each other as we move through. We are, to use the phrase, building the plane as we fly it. This is new for all of us, and so all of us are kind of navigating it real time. And so I think that what all these people are doing is really trying to make the best decision they can with the information they have at the moment. So we talked last week about us moving from pandemic level red to orange. Certainly we see much more vaccine availability than we did early on in this. And so the schools moving away from the mask mandate as the health departments are, I think is just a reflection of us, like Dr. Ledke was saying, hopefully moving towards more of an endemic than a pandemic, and our numbers decreasing. I am hopeful that parents will really consider vaccinating their children, not only for their child's protection, but for the community, as will the other adults that are yet to be vaccinated in our community. But I think we all have to try to find the right balance. So for it being too soon, I would say, we still have a lot of positivity going around in our communities. The people that are known to be high risk know who they are. So I would still strongly consider for them those mitigation factors we've been talking about all along. And really for anybody that feels uncomfortable with the loosening of the restrictions, certainly it is not the wrong thing to continue to mask or to avoid public crowded places. Hand washing has been a recommendation from a public health perspective well before coronavirus. So I will continue to push hand washing always, whether we are in a pandemic or an endemic. And we will make the best decisions as new information comes. So if we see a big surge in our numbers, we'll address that when it comes. I am hopeful that we will, as more people, as Dr. Ledke was saying, we have fewer susceptible people in our community that will continue to see the numbers trend down.
Great. Dr. Ledke, any additional thoughts?
Yeah, I mean, this is a really divisive topic, masking, and the school board, I just want to give kind of a shout out. They have really done a good job. They have hard decisions to make. And I'm not going to say whether or not this is the right move. As an infectious disease physician, I always, tend to, I think, err on the side of caution. Here's what I would say. If you have a child that goes to these schools and you're concerned, I would put a mask on them, and the quality of the mask makes a big difference. So, what we typically do is a KN95 on our kids, and they tolerate it pretty well. So think about continuing to mask regardless of the requirements, and of course, as Christine mentioned, getting the kids vaccinated. So I think time will tell whether or not this is the right move. I think that the school board has done a really, really good job. And I also want to give a shout out to Lisa Peacock. She's been in a really, really incredible force, science-based, very thoughtful. Thank you for her leadership. So I think time will tell. I think if you're cautious in your concern, just put a mask on. I know my children will continue to be masked.
Thank you, Dr. Ledke, and thank you, Dr. Nefce. The next question, we actually have two questions that are very similar. I'm going to ask Dr. Nefce to comment on what does it mean for Munson's strategy towards COVID-19 as public policy shifts towards a more endemic approach? Are we still moving towards orange pandemic status that you mentioned last week?
We are, and again, the pandemic levels are irrespective of which infectious agent is causing the pandemic or the endemic. We're going on numbers on what we're seeing across our communities from a hospital level, both as in patients as well as our staff. So as we continue to see improvement in those areas, we'll continue to lower our pandemic level, but really based on the metrics and other things that we're following.
So Dr. Nefce, is Munson Healthcare still in red? And if we're in orange, has anything changed with visitation policies?
As of today, we are still in red, so nothing has changed.
Great, thank you. I'm going to ask, I'm not sure if I should ask Dr. Nefce or Dr. Ledke about this question, but it is there an antibody test that is useful? Dr. Nefce, can you comment on that first?
I'll let Dr. Ledke go.
Okay. See, I got it wrong.
Yeah, that's okay. That's okay. Definitely, there is a COVID antibody test, and we actually don't use it that often for a couple of reasons. First of all, it doesn't define acute infection. Okay, so if somebody comes in with symptoms, you can't send an antibody test. It just doesn't work like that. It also doesn't necessarily correlate with protection. Okay. So if somebody got a vaccine or had COVID, their antibody test isn't necessarily going to be positive, okay? It's not 100% like any test. It has false negatives and false positives. So the immune system is an incredibly complex cascade of responses that includes cellular responses, hormonal responses, and this is just measuring not even all antibody levels. This is just IgG. This is just one family of antibodies. So it does exist. It's not particularly helpful. We offer it as a send out through our lab. And I would just, I guess, take caution in interpreting that. If it is positive, it likely reflects either an exposure to COVID or vaccination. It doesn't necessarily mean that you're 100% protected. It doesn't mean that you're not protected if it's not there. So sorry if that's a murky answer, but that's kind of how we think of it, if that makes sense.
Thanks, Dr. Ledke. No, I appreciate that. Dr. Nefce?
Yeah, no, that's exactly
Okay.
right, and why we aren't really recommending it as a test that provides a lot of value as far as clinical decision making.
Great. And Dr. Nefce, is it, there's someone asking a question, their physician has told them that they didn't qualify or they shouldn't receive antiviral therapy. Are there reasons for some patients not being eligible for antiviral therapy?
Yeah, absolutely. And it's in large part a supply chain issue. We just simply don't have enough to give to everybody. And so through the state and the CDC, there are tiers of who are the highest at risk. So, being unvaccinated is a high risk. Age, there's a lot of other clinical conditions that put you at risk. That gets adjusted as availability increases, but right now, as we spoke earlier, the severe limitations on the availability of these treatments is really forcing us to have only those that are the most at risk have access to the treatment.
Thanks, Dr. Nefce. Tony, I have one more question for you. Vaccines have been available for more than a year now. Is there any reason why you're launching an art contest now?
Yeah, so gosh, I would say that this came into fruition as an idea a long time ago, and it has taken some time to put together. It's spanning across all of northern Michigan. You'll see our drop-off sites are many, and I think that whether it's now or earlier or later on even, the message is still good. So we just want to continue to be sure as an organization that we are showing the community the best option.
Great, thank you, Tony. Dr. Nefce, one last question. What kind of long-term psychological impact on society is expected to be caused by the pandemic?
A great question. I think that any practitioner will tell you, as will anybody that's in education, that the mental health impact of this pandemic has been huge. Dr. Ledke and I both have kids in various stages of school, and would tell you that, the adaptations that they've had to make, being at home, away from their friends, there's a lot of things. And I'd say adults are seeing the same thing, the work from home impact on how that has us, team dynamics and all of that. And just the general stress level and fear that some people have, the political divisiveness that's been a result of this in large part, I think has had a huge impact on us culturally as well as on our mental health. I think that the death rates, we will learn later the impact of those. It has to be said that what this pandemic has shown us very clearly is that access to care based on ethnicity and the impact that those health conditions have if you are a person that's not well covered, either from an insurance level or through access to care, has been huge. So I think that we know there's been a lot of detriment to this pandemic. I think we are still learning how deep that is. And to just add on to Tony's statement of why now, that is in part of it, right? We are still in it. It's not over. We are still learning a lot. And, we have really used very traditional means at getting information out to people about this pandemic and what you can do and the impact it has and all of that. And I think we've really extended that as far as it can go. The arts reach people in a different way. And so we're hopeful that all of the information that we've been trying to get out to people, whether it's the mental health impact of this pandemic or the benefits of vaccination or, the stress on the healthcare system, the stress on families, all of those things, we're hoping we'll be able to reach more people with that information so they can make decisions for themselves and their family. If we can reach them differently through the arts, our goal is really to educate people and get the right information out to them.
Great, thank you very much. I appreciate all of our panelists today. We are unfortunately out of time, but we did get to all the questions today. So I want to thank everyone who asked a question, and for your engagement and participation today. So thank you, Dr. Nefce, thank you, Dr. Ledke, and thank you, Tony. We're really looking forward to the outcome and seeing some of the artwork submitted. I do just have one final slide. I want to remind everyone of that other ways you can engage with Munson Healthcare besides these press conferences. We encourage you to sign up for our biweekly e-newsletter that has both COVID and non-COVID information in it. We invite you to follow us on Facebook, LinkedIn, Instagram, Twitter, and follow our YouTube channel. We always keep munsonhealthcare.org as up to date as possible in our COVID-19 sections. That includes any possible closures or changes in hours as we continue to deal with staffing challenges related to the pandemic. And then, as always, our Ask a Nurse hotline is available to you at 231-935-0951. You can ask any of your COVID-19 related questions, vaccine questions, or general health questions. So thank you again, everyone, for joining us on this February 15th. I hope you have a wonderful week, and I'm not sure when the next press conference will be, but we will keep you informed, and we will post that information and send out a news release the next time we have a press conference. Thanks, everyone, and have a great day.